Wait a second. Alrighty, I just wanted to say hello to everyone. My name is Abigail. I am not speaking today. You get to hear from Ava, but I am actually the new wellness coordinator for Cincinnati Sports Club. So these presentations, I'm kind of going to be behind the scenes on those. So if you guys ever have any ideas of presentation topics, things that you're interested in hearing, I'm all ears. But I just wanted to pop in and say hello, and I'm really eager here for Ava to kind of take over and for us to hear.
All right. Well, welcome everybody. Thank you so much for coming out to listen to me talk about pelvic floor therapy. My name is Ava Franke. I'm one of the pelvic floor therapists that works upstairs at TriHealth. There are two other therapists that work with me, Mara Town and Amberly Johnson. All of us are more than happy to help you guys with any questions you might have if you do have questions after the presentation tonight. I'm so excited that so many people are interested in the pelvic floor. It's such an important topic and literally affects everybody, and it's not talked about enough. So I'm always happy to spread the information a little bit. Okay, so here we go. So what is pelvic floor physical therapy and why do we need it? I have a few questions. I want you guys to think about these questions and think if any of them apply to you, okay? So have you ever felt that you peed your pants a little bit when you coughed, sneezed, laughed, or jumped, right? Do you get a really crazy urgency when you're going to the bathroom? Like you feel like you have to pee and you have to pee now and you're rushing over there, okay? Are you ever unable to make it to the bathroom on time? Do you start rushing and then suddenly get there and realize like, oh, well, I already went, okay? Do you have any pain with intercourse? Do you ever feel constipated or bloated? Do you feel like you have a weak core? Do you feel like you have pain in your hips or your low back or your pelvis? If any of these apply to you or have ever applied to you, you most likely need to go see a pelvic floor therapist. These are all areas that we work on and that we are experts in and can help improve, okay? Let's see if the clicker works. So I'm gonna start with a little bit about me. The pictures, my husband and I and our two dogs, Dallas and Stella. We're obviously also expecting our first baby in a few months now, so I apologize in advance if I ramble on or get a little out of breath. We're working through it. I'm originally from Cincinnati, Ohio. I grew up in Hyde Park. I actually spent most of my childhood swimming here at Cincinnati Sports Club pool, so I've come full circle at this point. I graduated from Tulane University in New Orleans with a Bachelor of Science in Neuroscience. And then I came back here for grad school for physical therapy school and went to the University of Cincinnati and got my doctorate of physical therapy in 2016. After that, I immediately left Cincinnati again and did travel physical therapy for about 6 years, where I worked in a variety of settings and got to meet all different kinds of people. It was a really great experience. But then COVID hit and, the world kind of ended for a little bit. So I moved back home to Cincinnati. And during that kind of lull, I decided to pursue pelvic floor physical therapy and start doing that coursework, which is about another year or so of advanced education. So I've been working in the pelvic floor specialty here at TriHealth for about almost like 3 years now, which is kind of crazy to think about. Okay, so what is the pelvic floor? Today we're going to kind of discuss some common pelvic floor dysfunctions that we treat. This list is in no way complete. Both men and women can develop pelvic floor disorders, which can be treated with pelvic PT. Most of what I'm talking about today is going to relate to people with vaginas, but again, can also be applied to all sexes and genders. Literally every human has a pelvic floor, and it plays a vital role in multiple body functions. It's a group of muscles that create the base of the pelvis. The muscles work to stabilize the pelvis. They provide sphincter control for remaining continent of our bowel and bladder. They create a sling for pelvic and abdominal organ stability. They help with sexual functionality, and they work with our lymphatic system. They're home to a lot of large lymph nodes that help pump lymph through our body. Okay, so it's a very important part of our body. Basically, the human body consists of 3 diaphragms, okay? The first one is our epiglottis. So that's our swallowing diaphragm, okay? That helps prevent food from entering our lungs. The next diaphragm, which is the most commonly known one, is our breathing diaphragm. That's what sits under the rib cage and helps us breathe and move our lungs in and out. The third is our pelvic diaphragm, which is actually our pelvic floor. All 3 of these diaphragms help regulate pressure throughout the body and help essentially regulate all of our vital functions. So you can see just how important the pelvic floor is just in general to being alive as a human, okay? Great. So the next, this is an image of the muscle groups of the pelvic floor. So you essentially have, like a 6-pack down there, okay? Your pelvic floor works with your diaphragm to help regulate what we call intra-abdominal pressure, okay? So when we inhale, our diaphragm moves down, our belly should actually stick out, and our pelvic floor should relax and lengthen. When we exhale, diaphragm contracts and moves up and in, belly should move up and in, and pelvic floor should move up and in with it. So we want it moving in this elevator-like motion, okay? Unfortunately, none of us learned how to breathe the right way. So when we pick up something heavy or we exert, we tend to do what? We hold our breath, right? And that actually compresses that cylinder and increases all of that intra-abdominal pressure and puts a crazy amount of pressure on our pelvic floor. So that's why a lot of times when we have that incontinence, when we're coughing or sneezing, we're just getting all of that downward pressure and there's nothing to support it, so the urine comes out, right? So all of these muscles are working together to create this sling, and if they have any dysfunction, it can lead to a lot of other dysfunctions in the body, okay? There's also a series of nerves in this area that go through a lot of these muscle bellies, and so if a muscle is not functioning properly, chances are the nerve isn't not functioning properly, and then nerve dysfunction can lead to a lot of chronic pain and other issues that go on with the pelvic floor as well, okay? So what is pelvic floor physical therapy? So we as pelvic therapists, we specialize in this pelvic diaphragm and how it affects and works with our other body systems. Our main focus is educating about pelvic floor anatomy and lifestyle changes required. I guarantee you everyone in this room probably needs to drink more water throughout the day. Let's see here. We teach to regain control of our pelvic floor, whether that be through pelvic floor exercises or Kegels. There's more to pelvic floor therapy than just a Kegel. They're one of our several tools for pelvic floor dysfunction, but they're rarely performed correctly. So, every vagina is different, and sometimes Kegels aren't the answer, okay? So if your pelvic floor is weak, that can sometimes be caused by muscle tightness as opposed to just like loose weakness. So how many of you have been to a doctor and they're like, okay, you're peeing your pants, go home and do a bunch of Kegels. Like, do you even know how to do a Kegel? Right. So then you're kind of home and you're trying to figure this out. And sometimes if you have that tightness there, doing Kegels is actually going to make what's going on worse, right? If you think about it, I always tell my patients it's like trying to do a bicep curl starting from here. You're not going to get any power because everything's so tight. So we want to work on lengthening so we can strengthen through that full range of motion and make things function a little bit better. So I hate the response of, oh, I've been doing my Kegels. And I'm like, all right, well, has anything gotten better? No? Okay. So just be mindful and wary of that. I think I spend more time teaching patients how to relax their pelvic floor than how to actually do a Kegel. It is an important skill to have, but we need to be able to do everything, right? If you are doing Kegels and you find that your leakage and your pain and nothing is getting better, stop and come see a pelvic PT. We also use modalities to help reduce pain and tightness and improve coordination of the pelvic floor. So I'm actually certified to dry needle the pelvic floor. Has anybody here heard of dry needling before? Okay. It's a form of muscle trigger point release where we use really thin filaments and insert them into the muscle belly, kind of like acupuncture, but a little bit different. It's a little bit more, muscle oriented as opposed to chakra oriented. And it's very effective in releasing muscle tissues and decreasing pain. So that's a major part of my treatments now. We also use a lot of manual therapy techniques, so that can include like trigger point release, myofascial release, cupping, all of this kind of stuff to help relax the muscle tissue, okay? And then we also teach you how to do this kind of stuff at home, so if any of your symptoms come back, you're able to help fix it on your own, okay? And then lastly, we want to incorporate safe and proper body mechanics into your daily life. So back to that pressure regulation, okay? So learning how to breathe the right way is extremely important when it comes to pelvic floor therapy, and that's mostly the first thing we start to work on with people when they come to see us, because again, none of us are doing it right. So we're gonna learn how to breathe the right way today. So I want everyone to put your hands on your shoulders, okay? And then take a deep breath in, okay? Good. How many people's shoulders moved? I see quite a few already, okay. So now I want you to put one hand on your chest, one hand on your belly. When you take a deep breath in, I want you to think about sticking your belly out, okay? So you're gonna take a deep breath, and belly's gonna stick out. Hand on your chest is gonna move not really at all. And then exhale, belly is gonna come in, okay? Good. So this is what we call diaphragmatic breathing. This is allowing our diaphragm to expand all the way and actually help relax our pelvic floor. It also helps stimulate our parasympathetic nervous system. So our body is broken up into two nervous systems. We have the sympathetic, which is our fight or flight, running from a bear response, and then our parasympathetic, which is our rest and digest, allowing everything to calm down, allowing our bowels to move, allowing our bladder to work properly. Most of us are living in fight or flight all day, every day, right? Where we're shallow breathing, we're running around, we're doing a million things, we're tense, we're tight. So this diaphragmatic breathing is a really good way to help stimulate that parasympathetic nervous system and get us back into that rest and digest mode. So I usually tell people every hour, stop, take 5 to 10 deep breaths and see where you are. You might be clenching in areas that you didn't even know, especially your pelvic floor. Great. If that pressure isn't regulated properly, that's when all of these dysfunctions start to develop. So we can have the incontinence, we can have a prolapse, we can start to develop pain, and you can just feel like everything is not working the right way. So this is the base. And I usually give people like a week to say, okay, we're gonna learn how to breathe the right way, because it's gonna get really frustrating when we start doing any other exercises if you can't get this part down, because it's incorporated into everything, okay? So, these are some of the common pelvic floor disorders that we treat. Again, this is not the only thing we treat, but these are some of the things that we see the most often, starting with urinary incontinence, pelvic organ prolapse, pelvic pain, postpartum care, and bowel dysfunctions, okay? So we're gonna start talking about urinary incontinence. 1 in 3 women experience urinary leakage at some point in their life, okay? This is not normal. I can't tell you how many times I've had patients come in and say, oh yeah, like, well, you know, I pee my pants when I jump, but, you know, I had kids. That's just how it is. And I'm sitting there like, no, it's not. That's not how it is. It doesn't have to be that way. So there are 2 main types of incontinence. There's stress urinary incontinence and urge urinary incontinence. And then some lucky ducks get the nice mixed incontinence where you get both, okay? So stress urinary incontinence is that type of incontinence where you're jumping, coughing, sneezing, laughing, and you pee a little bit. And that's usually caused by a muscle integrity issue. So that means your pelvic floor muscles either are not strong enough, they're too tight, or they're not contracting in a coordinated manner to help prevent that urine from coming out. The second type is what we call urge urinary incontinence, and that's usually caused by a bladder irritation issue. Or also known as overactive bladder, okay? It's characterized by a very active or irritative bladder, and you have that frequent and sudden urge to urinate during the daytime or even at night. It's caused by that involuntary, spontaneous loss of urine. You feel like you just like, well, I guess I'm peeing, right? And this is also that feeling that you get when you feel like you need to urinate constantly, or you're rushing to the bathroom and you don't make it on time, okay? And this is usually caused by an irritation to the bladder. So a lot of times to solve this urge incontinence, we have to do some lifestyle changes, okay? because your brain and your bladder are sending the wrong signals, you're getting signals that you have to pee when you actually don't because your bladder lining is extremely irritated. So think of it as like, you have a rash on your hand and you keep rubbing irritating substances on it over and over and over again. That rash is going to keep getting worse and worse and worse, right? We want to soothe it and let it heal so it doesn't continue to be irritating. With the bladder, certain foods and liquids can be really irritating to the bladder lining. So things like caffeine or things high in sugar or citrus or things with fake sugar. Honestly, the only substances that are really soothing to the bladder is just plain water. Doesn't include seltzer water, that doesn't include flavored water or Gatorade, it's water. So, I have a lot of people come in and like, well, what are you drinking during the day? And they're like, oh, like I drink sweet tea or Diet Coke. I was like, okay, how much water are you drinking? I was like, oh, I take a little sip when I'm taking my pills, right? I mean, the recommendation is to actually drink half your body weight in ounces of plain water a day. And when you have any caffeine or soda or sugary drinks, that actually kind of cancels out the water. So if you think about it, you need to increase that even more. I know a lot of you are thinking, well, when I drink more water, I pee more. It's actually kind of counterintuitive because the more water you drink, the less you're actually going to pee because your bladder is going to be less irritated and allow itself to fill. So you'll pee less often and you'll pee more, if that makes any sense. So these are all things that we see all the time in pelvic PT, and people actually get better. Like they stop completely peeing their pants. So there is a solution. We can fix it, but it does help to actually come see a professional and let us do an assessment because every person is different, and what's going on with your bladder might be different from what's going on with your friends, even though you're both leaking, okay? Next, we have pelvic organ prolapse. Prolapse is a scary word. Most people kind of like freak out when they hear they have it, right? The word prolapse means to slip or fall out of place, okay? This affects about 50% of women at some point in their life. Some of the causes are childbirth, great, can't wait. But almost all women do have a small prolapse after having a vaginal delivery. It's just part of it. Most of the time, especially if they come see a pelvic PT, the muscles tighten back up and everything's good to go. But a lot of times they don't, and then that small prolapse, because we're not regulating pressure the right way, continues to get worse and worse. And then as we age, which is another common cause of it, our muscles get weaker and weaker, and it just progresses to the point where it can't be fixed anymore, okay? So vagina is a tube, right? We have our bladder sitting in the front, and then we have our rectum sitting in the back, and then we have our uterus sitting right on top, okay? So normally our vaginal walls, which are muscular, are supporting all of these structures and holding them in place. With pregnancy, the vaginal walls, one, are holding a heavy weight for 9 months, and then with their final exam, they get stretched out to oblivion, okay? That puts them at a very high risk of that extra weight of the bladder or the bowel pushing down and causing those walls to collapse in. So if you're told you have a bladder prolapse, it doesn't mean that your bladder is falling out of your vagina. It means that your bladder wall has actually your vaginal wall has caved in because of the weight of your bladder. If we catch it early enough, we can strengthen those muscles and get that support back so we don't have that prolapse anymore, okay? Some common symptoms, I don't really like to read the symptoms because everybody here is going to think they have a prolapse, but some common symptoms of a prolapse are leakage of urine, inability to completely empty your bladder, so you sit down, you feel like you have to like push the urine out, a feeling of heaviness or fullness in your pelvis, if you actually feel like a bulge in your vagina, like you feel like something is coming out, or any aching or feeling of pressure in your lower belly or in your pelvis, or constipation. Again, if you have any of these symptoms, it doesn't necessarily mean you have a prolapse, but it's more if you have a prolapse, some of these might go hand in hand with it, and vice versa, okay? So there are 4 types of vaginal prolapse. There's the cystocele. These are all the big words that you might hear at the doctor's office. So cystocele is that bladder prolapse. That means that anterior wall has kind of collapsed in because of the weight of the bladder. There's the interocele, which actually happens further back, and that actually means that posterior wall, like posterior and top, has caved in from the weight of your small intestine. Again, that does not mean that your intestine is coming out of your vagina. It just means that that wall is caved in a little bit. There's your uterine prolapse. So that's when your pelvic floor muscles and the ligaments that support your uterus have stretched and weakened. And so they're no longer provide enough support for the uterus, and so the uterus kind of starts to slip down, okay? And then there's the rectocele, which is when this posterior wall where your rectum sits caves in a little bit. Again, with strengthening, we can usually make all of these better. We do get to the point sometimes of no return where, it's been going on for a lot of years. You're at a different, like the grade of the prolapse is so much worse that the elasticity in the tissue is kind of gone. And at that point, that's when we'd refer you to a urogynecologist for a surgical option. But I always recommend coming to see a pelvic floor therapist first to see, because surgery is scary and invasive, and let's see if we can get something better before going into the surgical option. Okay. There's also something called a pessary, which is basically an insert into the vagina that's going to help hold the prolapse into the correct place and can actually work really well in conjunction with pelvic PT to help build that strength back and make life a little bit more comfortable for you if that is something that you're feeling. Okay. Next we have pre- and postpartum care. Okay. So we work with pregnant women before, after, and during therapy because obviously this is a time where our bodies change a drastic amount in a very short period of time. So some of the major changes that happen are the weight of the growing fetus, increased lordosis of the lumbar spine. So I can actually show you exactly what this means. When we are pregnant, we tend to want to stand like this, right? So in this position, I can't activate my abs. I can't squeeze my butt at all. All of the strain is going onto my lower back, right? So I'm constantly reminding myself and telling patients, tilt your pelvis under a little, because now I can use my butt muscles and I can actually engage some of my core muscles to make things move a little bit better. So a lot of these body mechanics are really important during pregnancy, but a lot of it's just kind of a survival thing, so you do what you can do. But we also have changes in our abdominal wall, right? So like our abdomen stretches and our abs stop working, our SI joint, our pubic symphysis. We also have all these really fun hormonal changes. So all of our ligaments go completely lax and everything starts moving. And a lot of women go through this and we survive and we're like, okay, great. And then your doctor sends you on your way and says, good luck. And then none of this ever gets fixed. And then we end up with issues like incontinence and prolapse later in life that was never addressed. So I'm so happy that this is becoming something that's more common with women right after having babies because we can help maybe prevent some of the issues in the future by doing the education early. There's also, vaginal delivery versus C-section. I can't tell you how many people have told me like, oh, I don't need pelvic floor therapy because I had a C-section. It's like, well, actually you do because you had a major abdominal surgery. And even if you had a C-section years ago, we have, they cut through all of your core muscles. Sometimes you even still labored and then had the emergent C-section. You were also pregnant for 9 months still. So all of that pressure is still there. And we do build a lot of scar tissue under those C-section scars. And that's something we work on as pelvic floor therapists to help release because scar tissue can hold a lot of tension and cause a lot of issues for us in the future, okay? If you know anybody that's pregnant or just had a baby, please send them to pelvic floor therapy. It'll be really beneficial for them in the future, I promise. Another major thing that comes along with pregnancy, but can also happen as we age and as our muscles get weaker, is something called a diastasis recti or a DRA, okay? So when we're pregnant, in order to make room for a baby, our core muscles have to separate, right? Normally, they just come right back together, no problem. But especially after a C-section, or if you have 3 other kids at home and you need to lift them and do things, right? You're going to be straining your abs too early, and that separation stays there, and that puts you at a risk for a hernia, okay? So again, that's where that pressure regulation and that breathing comes back into play, where we really want to work on decreasing the amount of intra-abdominal pressure and regulating it evenly through our core so we don't cause that hernia to happen or the prolapse to happen, right? Okay, let's see here. I think we're here. Okay. Next we have bowel dysfunction. So, some common bowel dysfunction goes hand in hand with urinary, really anything going on with the pelvic floor. Usually people have bowel stuff going on too. The systems are right next to each other. They're all, affected by the same systems. So it makes sense that if you have urinary issues, you're probably gonna have bowel issues too, and vice versa. Some common dysfunctions that we see, again, not limited to, but some common ones are fecal incontinence, irritable bowel syndrome, and constipation. It is normal to poop every day. And if that's not happening, there's usually something going on either with your lifestyle choices or with the pelvic floor that can be corrected to help improve this. Constipation is also just a huge issue in America anyway. And so pelvic floor therapy can really help because, again, we go deeper into your history and figure out what's going on and can give you a plan to help get bowels moving the way that they should. I'm going to tell everybody right now, again, most of that is water intake. So everybody start drinking more water. People normally don't just have one pelvic floor dysfunction. So if you think about it, if you have a tight or a weak pelvic floor muscles that affect your bladder, obviously it's going to affect your bowels. I've been a physical therapist for almost, 10 years now. And the more I learn about the pelvic floor, I'm just shocked that I was ever taught to assess like hip or back pain and not actually look at the pelvic floor, because it's like there's this whole other muscle system that we're just missing. So a lot of times people will go to regular PT for their back pain and nothing ever gets resolved, and then they end up with surgery and pain, and it's like, yeah, well, there's this whole other muscle system that nobody even took a look at. So our final group here is pelvic pain, okay? 1 in 5 women experience some sort of pelvic pain. It's actually one of the most common reasons people go seek a gynecologist for help. This can include pain with intercourse, the low back and hip pain, pain with tampon use. Again, it's not normal. That's not something we should feel all of the time. So some of the big words you might hear that are associated with vaginal pain are dyspareunia, which is the sex with intercourse, or vulvodynia, which is a pain or burning in the vulva. So it's like this external burning and pain. It can be helped significantly with pelvic floor PT. Again, shocker, pressure regulation, right? Manual therapy for tissue release, desensitization of the tissues, dilator therapy is a huge help in this department, and also the dry needling. But we also want to help strengthen all of our support structures, right? So that includes your hip, it's in your core and your back, to give the pelvic floor a break. Because a lot of times when we have this chronic pain, it's because our pelvic floor is working in overdrive, trying to make up for all of the areas that we're lacking in, okay? Let's see here, got myself all out of order. Okay, so how do we treat these? With pelvic floor physical therapy. Has anyone here been to see a pelvic floor therapist before? Great, okay. So just to kind of give you a rundown of what it is, because it is a little different than regular physical therapy, okay? If you come in for a typical evaluation, usually it's about an hour, which again is different than most therapies that you'll see. And we start getting your whole medical history. We talk about all the fun stuff like peeing, pooping, and sex. And then we do an external exam where we take a look at the whole body, hips, knees, back, belly, see what's going on there. And then they actually do an internal examination where they check vaginally, internally, the integrity of your pelvic floor muscles and your strength, okay? Again, a much more thorough exam than you're gonna get anywhere else, and we can actually take the time to look at the whole picture. One of the main perks, for me at least, of working in this setting is I get to spend 45 minutes to an hour with all my patients one-on-one, which is huge. In most other outpatient PT settings, as a therapist, you have to see 2 to 3 patients at a time. You maybe get 10 minutes max, like one-on-one with your patient, and then they're set off doing their own exercises the whole rest of the time, right? Which is fine, and it works for that setting. But for us, I spend a lot more time doing manual therapies. I can actually listen to what's going on with my patients and cater to their exact needs. And you get my full attention the whole time, which is great. So it's billed to insurance like a regular outpatient PT visit. It's not some like specialty extra thing. So if your insurance covers physical therapy, it will cover pelvic floor. You don't necessarily have to have a referral in the state of Ohio. We are direct access. So you guys can always like come upstairs if you're working out here or something and say you want an eval. We'll send a note to your primary care or your gynecologist, whichever. But we can see you right away. And yeah, more times for the hands-on treatments, and treatment sessions are very specific to you, which I think is huge. I blew through that a lot quicker than I thought it would, but I'm so excited to hear any questions any of you might have, because I know we probably have a few, and then I have a couple of handouts that I can send you all home with, just for some general stretches, and we can kind of go over those together here, just to help relax the pelvic floor and work on some of that breathing. So does anyone have any questions? Okay, go ahead.
I was wondering if you had a recommendation for any specific kind of exercises, like biking and walking are the two I try to do, but normal things that we would incorporate in our daily life, or what do you have to say about that?
I think any exercise is great. The more you move, the better. Do you have any like issues with the biking or walking?
No.
Or yeah, I think those are perfect. I think walking is one of the best exercises we can do. It gets your heart rate up, it gets everything moving. I would just be sure that you're stretching before and after, so we're avoiding any of the tightness. Okay.
Any others you'd recommend that maybe we're not doing?
Like as far as cardio exercise?
Or maybe on your handout you'll have some.
We have a couple. Those are mostly stretches, but as far as strengthening stuff goes, I mean, it depends. I would have to see what's going on with you specifically, just to kind of get an idea of what's feeling weak and that kind of thing.
I did just want to ask about the biking.
Yeah, I think that's great. Good for you. You had one over here, yeah.
You mentioned water, plain water.
Yes.
But I drink a lot of water with the hydration tablets.
Yep.
Like noon or.
And that's fine.
Okay.
You just want to watch the sugar. So like.
Yeah, they don't have sugar.
Yeah, so things like liquid IV is better than like Gatorade, which has like 30 grams of sugar.
Yeah, no Gatorade.
If you're drinking those and you feel like you have to pee more frequently, they could be irritating to your bladder. But if not, then
No, it's probably the coffee.
yes, that's most likely what's going on.
Darn it.
But don't cut out the coffee. We all need coffee. But it's more just balancing it out and making sure you're getting enough water to help compensate for the amount of coffee that you're drinking. Okay. Any other? Yeah.
I have a couple, but my first one is you were talking about the Kegels and how those can be done wrong.
Mm-hmm.
If you were saying how important it is to learn how to breathe properly, can you be doing that wrong and like making it worse?
Mm-hmm. For sure. Kind of like when we went over the proper breathing technique. I mean, a lot of us do this shallow breathing where we're just lifting our shoulders and not getting that full deep belly breath into our pelvic floor. And I guarantee you, I was breathing the wrong way until I started doing this job, and I just teach people how to do it a million times a day, so that's the only reason that I'm doing it properly. But really taking the time for when you inhale to get that deep belly expansion, and then when you exhale, your belly's actually supposed to move up and in. So it's kind of like it feels like the opposite of what you would normally do. And it's not that you're going to breathe that way all the time. Like if you are exerting or exercising, you want that shallow breathing. But when we're just sitting around resting, we don't need to be in fight or flight mode. We can relax and let everything kind of calm down a little bit.
Then, my next question was just about menopause and how that might your pelvic floor? Are there like kind of key changes that occur?
There are a lot of things. One major thing we see is a lot of dryness and vaginal irritation, just because we're having such a fluctuation in hormone levels. So a lot of times we'll work closely with the urogynecologist, making sure, like, if the patient needs certain topical agents to help with lubrication of the vaginal tissue. It can help a lot with pain. There are also some pain associated because of the dryness, so a lot of that tends to go hand in hand. And then just in general, all of the changes your body's going through, maintaining strength through menopause is challenging but really important. Yeah.
How much is enough water?
Half your body weight.
Half your body.
Half your body weight in ounces of water. So, or good liquid, but yeah. So say you're drinking 10 ounces of coffee in the morning and you need to drink like 50 ounces of water a day, right? You probably need to add an extra 10 ounces of water to help make up for that coffee that you had, or Diet Coke or whatever it is. But I tell people to increase slowly. So if you're a person who's only drinking like 10 ounces of water a day, don't immediately go up to like 60 because you're probably going to overload your system. So slowly work your way towards it. And it takes a couple weeks for everything to start calming down, but it will probably start to help a lot. It is a full-time job drinking enough water. I have to constantly remind myself to drink water too, so yeah.
Okay, so do you cut off the water before you go to bed? Or
So if you
before?
find that you're waking up constantly at night to pee, I do recommend 2 or 3 hours before bed to stop drinking any fluids, just to give your body time to process it so you're not constantly waking up. Also, if at nighttime you feel like you're waking up frequently, it probably means that you're not urinating enough during the day, or we're not getting into our adequate sleep cycle, so your body still thinks you're awake and it's still waking you up every couple hours to pee. So again, it's a situational thing. But yes, if you are waking up a lot at night, we do recommend stopping liquids a couple hours before bedtime. And making sure you're going to bed at a good time and not like 1 a.m. because then you never get into your sleep cycle. So, yeah. Yeah.
What about walking, and like if you get tired, you tend to maybe hunch over more, or going up levels of steps? Does that have to do with your pelvic and tucking it in, like you demonstrated?
It can for sure. And like, we all kind of end up in this position throughout the day, whether we want to or not. Computers don't make it any better. Some of it's making sure our pelvis is properly aligned. Some of it's also making sure we have enough strength in our upper back muscles as well. And so it's all it all works together. But just building that strength. Core is huge. Again, we spend a lot of time sitting, so our core doesn't have to be as activated as it once did, I guess. So really trying to get into that pelvic tilt is going to allow you to actually activate your core more as you're moving around during the day.
So when you say pelvic tilt in, when you're
Under more.
under.
So you're going to kind of tuck butt under. I can still do it.
Just don't tip over.
Right. Yeah.
I have a person that breast cancer survivor, and they thought it had gone into my uterus, so I have a total hysterectomy.
Mm-hmm.
And nobody ever told me about scar tissue, so I have like a stake from my belly button to my.
Yeah.
And I don't think there's anything I can do about that.
We can definitely mobilize that scar tissue. I do see a lot of women after.
I mean, it's been years.
Right. Nope. You can still mobilize it. You can still mobilize it. So we use like manual techniques. We use cupping. Even sometimes the needling can help loosen a little bit. It takes a little longer with an older scar, but sometimes even just one session of cupping, you're gonna be like, oh my God, my skin's actually moving. Like that feels different. Yeah.
See, nobody's ever.
Scars. Right. No, of course not. Why would they?
I mean, they're
That would
all
make too
nail
much sense.
doctors, you know?
Right. Exactly. Yeah.
Did you say that you don't have to have a doctor's appointment?
You don't have to have a referral. We can get it from now. Okay. If you have Medicare, we'll send your primary care or your gynecologist still has to sign off on your plan of care, but you can still make the appointment with us first, and then we'll call the office to get the referral. So if you're not seeing somebody regularly or you don't have time for that, you can still make the appointment sooner. But if you are seeing your doctor and you want a referral, they'll just send it right over. But now with all the electronic stuff, it takes like 2 seconds, so it's not that big of a deal. Yeah. Did you have, yeah.
I was going to ask if you could
say a little bit more about the, was it the diastasis recti thing?
Yeah.
If that is, how that's connected or what it's doing and if that can be fixed or.
So, all of our tissues have a certain amount of elasticity, right? So if you think about like a rubber band, if you can stretch it and most likely it goes back together, but you get to the point where you stretch it too much and it can't. So same thing happens with our tissues, like our skin and our muscles. Most of the time with the diastasis recti, or that separation, with a little bit of strengthening and kind of like loosening of the muscles around the core, we can actually get those muscles to come back together, or at least come back partially. But if we've reached the point of no return, then it's it depends on the person and what's going on with their tissues. But a lot of times core strengthening can really help that. But we want to make sure we're doing the strengthening safely, and targeting the right muscle groups before we just start crushing a bunch of hardcore core stuff. So, yeah. I love all the questions. Any more? Yeah.
And you mentioned us being in fight or flight mode a lot throughout the day. How much does stress play a role on our pelvic floor health?
Extremely. It's like 100% there. Actually, a lot of women who end up having TMJ jaw issues, it directly correlates with the pelvic floor.
Pelvic PT for a very specific reason 5 years ago.
Okay.
And I completed a series of exercises, but I don't keep up with them.
Yeah.
But do people need to have maintenance, or
Yep.
Once you kind of resolve?
If you, you see those guys at the gym with the big biceps, right? Do you think they just got to that point and then stopped and then they get to keep them forever? There's still muscles, right? So we have to maintain. We have to continue to exercise. So a lot of times once the main issue is resolved, I tell people, this is something you're gonna be doing for the rest of your life, whether it be a couple times a week or you have a week where you wanna do more, but it's an important area to focus on, especially as we're getting older, because our muscle tissue deteriorates so much faster as we age and then takes 3 times as long to build. So once you have it, you wanna maintain it. So we don't lose it again. If you don't use it, you lose it. That's a very real thing. So, yeah.
I just have one of my OBGYNs at one point told me at every red light, do your Kegel exercise.
Yeah, they love telling you to do that.
What do you think about that?
I don't like that because they didn't actually do an assessment of 1, if you're doing Kegel the right way, 2, since you have a bunch of scar tissue, I'm going to guess we don't need to do any Kegels.
I don't do it at red lights. So
Right, but that's usually, because Kegel is kind of the only word that a lot of OBs know that is associated with the pelvic floor. So pelvic floor dysfunction, Kegel. We'll just say to do that, right? But there's so much more involved. And I think they're getting better. I hope.
Yes.
So, okay. Any other questions? This is my email address. This is also our number upstairs. We can also maybe send out the information if they need it. But if you do have any questions, you can feel free to shoot me an email. You can give us a call, come in for an appointment, whatever, and we can help you out too in that sense. Like I said, I will be gone in August, but my 2 colleagues are amazing, and they have plenty of space to see all of you if you do feel like you want to come up and give us a try. So, okay, I have a few handouts that we'll give out. I'm just going to kind of pass these around and let you guys grab one of each. Would I benefit from pelvic floor physical therapy? That's kind of the questions I asked you at the beginning. It's just kind of nice to have this list and you can talk to your friends and be like, hey, do you have any of this stuff going on? I just went to this talk and here's some information about it. We want to spread the word as much as possible because we can help so many women and men, but mostly women, feel better, right? The second one is our 6 tips for better bladder health. So this again talks about our water. Aim to drink half your body weight in ounces of water a day. Limit the intake of caffeine, sugar, and alcoholic beverages. Those are considered bladder irritants and can increase that feeling of urgency and irritation. This does not mean you have to cut all of these things out of your life. Just be mindful. It's okay, whenever I have a glass of wine, I'm rushing to the bathroom every 5 minutes. Again, that's maybe a trigger for you. And it could be one of those situations where you're like, okay, I need to have my glass of wine tonight, or I need to have my coffee today, so I'm just gonna understand that I might be peeing a little bit more today, but I'm gonna make sure I'm drinking enough water during the rest of the week, okay? Avoid the just in case pees. I find that women are constantly doing this, like, oh, I'm gonna leave to go to the store, I gotta go just in case. Oh, I just got home, I gotta go just in case. Like, those create these really bad habits for our bladder, and actually lead to more bladder dysfunction and more of that constant urgency feeling, okay? Do not strain or try to push the urine out, okay? This actually trains your pelvic floor muscles to work in the wrong direction, and can cause more issues and more leakage down the road. So if you're having trouble urinating, please come see a pelvic floor therapist to help us work out why that's happening, okay? Don't hold your bladder all day. So on the opposite end of the spectrum, we have people who are peeing maybe twice a day, and that's not good for us either. It probably means you're not intaking enough fluids. But if anybody here has worked as a nurse or worked in healthcare ever, you never get to pee. Teachers, you never get to pee. You get maybe 1 pee break a day, and that's not good for a bladder either. And eventually will lead to more frequent urination later in life, right? Avoid rushing to the bathroom. So if you get that crazy urgency to pee, don't immediately run. It's the movement and the rushing that's going to cause that leakage to happen. Try to stay calm, sit down, take a couple deep breaths, let the crazy urgency pass, and then go to the bathroom on your terms. You are in control, not your bladder. Do not let your bladder run your life, okay? Lastly, we have just some basic stretches to help relax your pelvic floor. So the first one is a figure 4 stretch. You can also do this in sitting, which I'm gonna do. I'm obviously not gonna get on the floor right now. But it's gonna help open up some of your hip rotators. So you do it in sitting, you're gonna kind of cross the leg over if you can, and then just hinge forward a little bit at your hips, and you should feel this really deep stretch kind of in the side of your hip. You can also do it in this laying down position, and you'll push your knee forward. So if you hinge forward a little, you feel that already? Yeah. The butterfly stretch, that's laying on your back. You're going to put your feet together and then drop your knees apart. This helps relax our whole pelvic floor and kind of open up our hips. It's a great thing to do like before bed, just to see if we can get some motion in the hips. If any of these are painful, please don't do them, but give it a try and see how it feels. Again, it can help us get a little bit more motion in there. The last one is the happy baby. So that's laying on your back. You don't have to grab your feet. I can't even do that. You can even just grab your knees. But if ever any of you have taken a yoga class or something like that, they utilize the stretch a lot. And again, it just helps open up the whole area, open up the low back, and keep everything relaxed. Yeah.
How long do you hold the stretch?
30 seconds to a minute. Okay. Any other questions? No? Feeling good?
Thank you.
Thank you guys so much for coming to listen.
Thank you.